Some big news today on COVID locally. The CDC defines long COVID as new, returning, or ongoing symptoms of the virus. So that includes fatigue, chest and joint pain, dizziness, headaches, brain fog. People suffering from long COVID are concerned about a decision now to close a MaineHealth clinic in Portland. It specializes in treating people with lingering symptoms of the virus.
MaineHealth officials have been working on this transition for several months, saying patients will be better served by their primary care doctors. But some patients say it's a decision that's leaving them out in the cold. News Center Maine's Vivian Lee has more.
Classroom to get that vision.
Marnie McLean is a former television news journalist. She now owns and runs a video production company, Moose Tree Media.
In-person volunteer.
But to say the last 5 months of her life have been a living hell is an understatement. It all started in June when she got COVID. A round of Paxlovid made her cold and chest pain go away, but the symptoms came back with a vengeance.
It was here that the main pain was, and the heaviness, and it made it difficult to breathe. I found that very scary.
Her symptoms were so scary, Marnie ended up in the emergency room. X-rays and other tests, though, came back normal. Marnie was finally told she had long COVID.
It was the constant pain, and I mean, struggling to breathe.
Federal health officials say lingering symptoms impact up to 30% of patients who get COVID. Symptoms that range from dizziness and blood clots to chest pain and other problems. But there is no proven treatment to stop post-COVID or why it even happens. Even more troubling, just released data shows 3,500 Americans died of long COVID-related illness in the first 2.5 years of the pandemic. After a 4-month wait, Marnie met with providers at MaineHealth's long COVID clinic in November.
They made me see that, yes, it's real. I'm not crazy, and we can find ways to help you.
She started feeling better after doing breathing exercises to open up her lungs and chest. She tried acupuncture and saw a trainer and a therapist, but she won't be able to continue at the clinic as a patient. Caroline Cornish, a spokesperson for the hospital system, says the clinic stopped accepting new referrals in September as it prepares to shut down in January. Cornish told News Center Maine in a statement, "As our providers have learned more about long COVID, it has become clear that our long COVID patients are best served by managing their health through their primary care team, who has a full picture of each patient's medical history instead of a separate post-COVID clinic." At Central Maine Medical Center's long COVID clinic, which is run through the system's family medicine residency program, there have been more calls from MaineHealth patients looking for help. Dr. Chris Decker oversees the program, which he says appointments are scheduled months out.
We have pretty long visits to kind of figure out what exactly is going on, and a lot of times a primary care doc doesn't necessarily have that time in a single visit.
Marnie is grateful that she has seen some improvement in her symptoms, but she believes the demand for treatment only underscores a growing need for more long COVID services, not less. In Cumberland, Vivian Lee, News Center, Maine.
And we'll have more information on long COVID and the resources that are available in Maine and New England on our website and our News Center Maine app.